This is the northern tip of Karnataka, close to the Karnataka-Maharashtra border, in the rural area of the Belgaum district, a place called Ghataprabha. Once a barren, rocky land, where trees find very little soil to take root, here stands a service organization that has quietly burnt the lamp of health and social service for last 75 years. Silent work, known to the villagers only by the service that it provides. Hospital for the poor, as they prefer to call it. But it is much more than that. Hospital is just the shining tip of the iceberg. More than 250 patients take benefit of its outdoor services every day, where they have to pay only rupees 20 for a year's consultation. The most neglected section of a village society and those who have the maximum mortality rates, pregnant women and children below 5 years, are treated free of cost. What is wonderful is that every patient is seen by a consultant and is investigated with state-of-art equipments, be it the 500 mA X-ray machine, the semi-automatic blood chemistry analyzer, or the Wipro G ultrasound machine. What is even more noteworthy is that the doctors and the staff treat the patients, 90% of whom are below poverty line, with compassion and love that even money can't buy.
We feel it is our duty to stay in the village and help the villagers at their doorstep, because in the interior villages around, they are in the hands of untrained practitioners and quacks, and in more critical situations, they just cannot afford to go to the cities and prefer to stay back home to suffer or die.
Patients suffering from tuberculosis from far and wide come to our sanatorium with great hopes. We have 5 general wards of 20 beds each and 30 cottages that provide isolation, rest and medical care to combat this silent killer disease. In case of emergency medical situations, the first thought that comes to the poor non-affording patients is to run to KHI, for they know that here no thought will be given to their financial condition, no advance money will be asked, and no efforts will be spared to relieve them of their suffering. The hospital case paper does not have a column for religion, not even for statistical purpose. I ask not your religion, not your money. I only ask, what is your suffering? Our principle has been to charge only the running expenditure to the patients. Over the years, several donors, various philanthropic organizations, and the government has offered help to buy new equipments, to build buildings, and to run welfare and health projects, so that the burden of these establishment costs does not fall on our patients, and they get the best and most modern treatment at a cost that is affordable to them. The hospital, spread over nearly 100 acres of land, has 200 beds in general hospital, 60 beds in maternity, and 130 beds in TB sanatorium. Our operation theatre is well equipped with 2 major OTs, 1 minor OT and 1 septic OT. We do all types of major operations, all types of endoscopies like gastroscopies, bronchoscopies, cystoscopies and urosurgeries. Our visiting specialist honorary surgeons perform specialized operations like ENT microsurgeries, intraocular lens implants, laparoscopic surgeries, spine surgeries and major oncosurgeries. A total of about 3,000 operations are done every year. This building hosts our free maternity and family planning wards.
Deliveries are conducted free of charge for first 2 deliveries because it is important that patients should come to the hospital and get delivered in clean, sterile surroundings. Home deliveries with their associated morbidity and mortality are now less common. We conduct around 2500 deliveries every year and family planning work is going on for last more than 40 years. About 700 tubectomies are done every year.
Several like-minded consultants from neighboring cities visit the institute regularly and offer their expertise free of charge.
Try to spend 1 or 2 days in a month in a place where there is charitable services offered, and you will get maximum satisfaction from that service.
Today, the rising cost of medicines is a great burden on the poor patients who often have to pay more on pharmacy purchases than our hospital bills. We can offer free service, but the drugs have to be purchased. Snakes invariably bite the poorest of the poor, but the costs of anti-snake venom are exorbitant. To minimize this burden, we have linked the in-house pharmacy directly to most of the reputed pharmaceutical companies so that with their consideration, the patients get all the medicines at a price that is 10 to 25% lower than the printed price. While we are recording this film, this patient of organophosphorus poisoning has been on respirator for last 15 days. His expenditure is borne by the institute as he cannot afford to buy even the medicines. He went home perfectly healthy 8 days later. And well, this is not an exceptional story. It is an everyday event in this emergency ward where each of the 30 cots has a central oxygen and suction and round-the-clock monitoring. The institute has a long line of voluntary workers who have found their happiness in life in serving the poor and being a part of the mission that is KHI. This man Rasool is working since 1947 and is still active at the age of 80, working as a lab assistant along with his son Sikandar. This is Ramchandra More, pharmacist, and his brother Prakash, lab technician. Their father had been working in the institute from 1946 till his death. Some of them are the third generation serving the institute. They all stay within the campus and are available for emergencies at any time of the day or night. A great family working together. They were all inspired by the dedication and influence of the founder Dr. G.R. Kokatnoor and his team, and later by the saintly Dr. Madhavrao Vaidya and his associates. They not only devoted their lives for the welfare of the villagers and the institute, but they also inspired a large number of voluntary workers to work with them with the same spirit of self-sacrifice and devotion.